Can I have a tummy tuck after previous hernia and mesh repair? I was considering Turkey because a friend of mine went for a tummy tuck. I saw a video of yours. It did state that patients that have had umbilical surgery with mesh can still have a tummy tuck, but it will depend on where the scar is positioned. Mine is above my belly button, which is the south with the mesh. Yeah, so the scar above the belly button's an issue with the tummy tuck. So there's two things, I guess. One is the actual mesh repair, which is what's going on internally, and the other is the fact that you've got a scar on the skin, regardless of what the scar's for. So any scars in the upper abdomen above the tummy tuck are a problem if you're going to have a tummy tuck. In the old days, they used to do gallbladder surgery with a large scar underneath the rib cage called a Cocker's incision. They all do it laparoscopically now, so you very rarely see that. But that was a real problem for tummy tucks. And if you've got a scar above your belly button, that's going to be a problem. So that really needs an assessment and a chat. If it's only a little bit above your belly button, and if you've got a lot of skin laxity, you know, we might be able to remove it at the time of the tummy tuck, and it won't be an issue. But if we can't remove it at the time of the tummy tuck, and we end up with your tummy tuck scar and then your umbilical hernia scar surgery somewhere above it, then that's an issue for healing. That's a real issue. So it's not a cosmetic issue, it's an issue for healing, having scars above the belly button, because the blood supply is going to be affected around that scar. And when we're putting that scar, that wound closed to get the tummy tuck closed, if you've got some compromised blood flow because of a previous scarring, you run the risk of wound healing problems. So it's potentially an issue. The actual mesh itself, not so much. No, the actual mesh itself is fine. We'll often need to do bring the muscles together, the divarification of the muscles together. So your muscles are often splayed apart, and we bring them together as an integral part of a tummy tuck. It might be difficult to do that if there's kind of a rigid mesh in there. It might be more difficult to do the repair of the muscles. So that will be something which, again, we'd have to discuss with you, or your surgeon would have to discuss with you, whoever you choose to have it done with. And that might be compromised, the ability to do the muscle repair, which, you know, you could decide whether you want to accept or not. But the skin excision should be fine, apart from the potential problems with the scar, as discussed previously.